Hey folks, welcome to DocTalk. Glad you joined us. Hey, thanks for y'all sending us some hats. We got Adams, we got Hosmer Vet Clinic, we got the Kansas Bull Test, Deseret Ranches, and today we're going to have a show on equine parasite control. Our guest, Dr. Chris Blevins. It's going to be a lot of fun. We're going to talk about some of the different worms that cause issues in horses, and we'll talk about how you can prevent them by working with your veterinarian.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey folks, welcome to DocTalk. Dr. Blevins,
Yes.
thanks for being here.
Thank you, Dr. Thomson.
Folks, we got Dr. Chris Blevins here from Kansas State University's Veterinary Health Center, where he heads up our ambulatory equine clinic. He's an associate clinical professor, but before we get to him, I'm going to say thanks. We got more hats that came in. Continue to send us your hats. We're going to get some hat racks and things built up, but Deseret Ranches, Adams Land and Cattle Company, the Hosmer Veterinary Clinic in Hosmer, South Dakota, and the Kansas Bull Test. So many different people, many different parts of the U.S., Florida, Nebraska, South Dakota, Kansas.
Wow.
It's a lot of fun. Keep sending us your hats and we'll keep putting them on the show. But today, we're going to talk with Dr. Blevins about the wormy horse. And what do we need to, what are some of the problems we get with worms? What can they cause in our horses?
Yeah, with horses and really kind of any species, it's very similar, but with horses, we always think about colic, and that of worms. But weight loss is the big one. That's one of the reasons that owners deworm their horses, but also diarrhea. Those are kind of the three big ones. With pinworms, they could get a roughened tail head, itch in their hind end, but that kind of is the main categories with problems that horses could get with internal parasites.
So when we see an adult horse that's out on grass and it starts to get a pretty loose stool and it's losing weight, that's got to be one of your top differentials, right?
That's right. That's when you need to get a veterinarian involved, and we'll talk a little bit later about just the aspects of how the veterinarian could get involved with that as far as recommendations.
How does the colic occur? I mean, I can get the weight loss and the diarrhea from the parasites, but do we just get a worm burden, or what causes the colic?
Yeah, there's a possibility of the colic due to worm burdens or encysted type of internal parasites within the lumen of the intestine, but also some of the internal parasites migrate through the lungs, through different parts of the belly or abdomen, and they can affect different aspects, not just the GI tract, but also blood and blood supply, and that could also be a big indicator and even be life-threatening.
Huh. So, when we see this, can it be infectious like horse to horse? Is it mainly pasture to horse? I've got stables we work with. We have people that have their own horses just kicked out on grass.
Yeah.
What are the different scenarios?
Mostly, you're right. It needs to have a pasture to get a lot of those strongyle type eggs that they were most concerned with, which most dewormers are trying to get rid of. But again, it takes blades of grass to kind of cycle that through. They can't just go from one horse to the other.
Okay.
Even though we say fecal oral, that's usually the main thing with that. Now, pinworms and some other things, that could be on different things, buckets and stalls and stuff, and ascarids, but mainly it has to go through blades of grass when you're talking strongyles.
It's kind of similar to feedlots. I mean, when we bring cattle in off of grass and put them in a dry lot, we aren't sitting there thinking about them with worm burdens in a feed yard, because we've pulled them off of the place where the ascarids and things are being hosted.
Right.
Anything else as far as before we go to break here on things that worms can cause?
I think worms can cause all kinds of things, even coughing. A coughing horse could be due to internal parasites. So really, anything internal parasites can be of different facets, and you just got to get your veterinarian involved.
All right, folks, when we come back, we're going to start talking about some of these specific worms and things that you're going to deal with your horses with Dr. Chris Blevins.
Working your cattle just got easier. Introducing the new Vet Gun delivery system, a new way to apply topical insecticides to your cattle. The Vet Gun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML Vet Cap is used with the Vet Gun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. Vet Gun. Check with your animal health supplier for availability.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Blevins. We're at Kansas State University, and that's where Dr. Blevins serves as our ambulatory equine practitioner and is serving horses all around and clients all around the region. So if you're in our region and you need someone to come out and take a look at your horse, this is a guy to have do it. He's an associate clinical professor here in our equine section. Again, thank you, South Dakota, Nebraska, Florida, Kansas, for sending us your hats. Continue to send those in. Well, Dr. Blevins, talk about some of the problems these worms can cause. What are some of the different worms that we're concerned about?
You know, like we were talking about too, a lot of them is strongyles, and with horses, that's our biggest concern. That has to come through the pasture, like we talked about. But also, you can break down the strongyles into large strongyles and small strongyles. We hardly ever hear about large strongyles because the different dewormers we use have pretty much taken it out of kind of contention of being a problem. But if we ever stop deworming horses, right, I think that's when we're going to potentially have the large strongyles coming back. The resistance comes through small strongyles. They seem to be becoming more resistant to a lot of our dewormers, and that's the very prevalent strongyle type eggs. Usually it's the small strongyles.
So what are some of the layman's terms for the different strongyles and things to that nature, that not necessarily little ones, but big ones, little ones?
Well, when you look at that, it could have all kinds of different, just internal parasites, cystosomas. Usually when we talk to owners, we just say strongyles or internal parasites is usually when we're just
worms.
Talking to them. Yeah, worms. Right. Right.
And so what other types of worms? You got a list here of different.
Yeah, we have pinworms. So when horses are, itching their hind end a lot, horses can get pinworms. It isn't one that pinworms we worry about can go from different species. I mean, this is a species specific, so it's just in horses, and horses transmit it to another horse. But if they start rubbing their hind end on stuff, getting a roughened tail head, they could have pinworms, and I think that's something we always have to kind of keep in mind based on that. The females actually deposit eggs around the outside, around underneath the tail, so that's why they get itchy back there, and that's why they rub their tail. The other one would be tapeworms. It's another one that kind of see a little bit more. Comes through the orbited mite. Has to be out on pasture. So that's kind of the secondary host, that orbited mite as it goes, and it can affect internally, usually around the cecum, ileocecal area there, potentially colic, so we can deworm based on that.
I was going to say that's probably when we're going to see those colic type symptoms with those. Yeah. It's amazing how sensitive the horse's gut is.
Yep. Yeah, it's one of the shock organs of the horse, so it's one of those things where they can really react.
Cows are not so much.
No, they're tough.
Well, I don't know if they're tough. They just don't have the same system. Other things you want to get, we got 30 seconds. We're going to go to break. Different worms or different things that people ought to think about? Yeah,
lungworms. Horses can get lungworms and cough based on that. They can get it from donkeys, so just deworm your horse. You don't have to euthanize a donkey or anything, but that is stuff to remember. And then bots. Everybody always hears about bots, in the stomach, and have seen pictures probably in different magazines and things, but that's another one that can work with.
Well, don't shoot your donkey as part of your worm prevention program.
Yeah.
Just deworm your horse.
Yeah.
When we come back, we're going to talk about some prevention strategies with Dr. Blevins, how to work with your veterinarian. You're watching DocTalk. Thanks for tuning in.
About 6 jumps later, I was laying on the ground and thinking, boy, my shoulder sure hurt. I kept waiting and it didn't get better and didn't get better. I'd heard about Kansas Regenerative Medicine Center on the radio. Got down there at 8 o'clock in the morning, and by 11:30 the procedure was all over, and it just kept getting better and better. And within 6 weeks I was back digging post holes and doing the other hard work that I'd been doing before the accident. And I'm really pleased. It's really worked out well for me.
Your investment in the Beef Checkoff is opening new doors for beef. Today and tomorrow, our commitment to long-term planning helps ensure your profitability from one generation to the next.
Hello, this is Caleb Plyler & Son Charolais. This is my son Hook and my wife Brianna. And we operate a purebred Charolais operation in Hope, Arkansas. You know, in the business that we're in, the beef checkoff dollars are very important to us. A lot of that money is to educate people, just like kids that's in Huck's class, the importance of eating beef. You know, it's a high protein product that it's a very important part of our diet. Sometimes we get this bad rap as beef is not, you know, what we really need to be doing from a dietary standpoint. But, you know, being able to get to the kids and let them know that, you know, beef, it is what needs to be for dinner. You know, one of the bigger things with our family is getting to go out and show off some of our cattle. Huck, he gets to show a lot of heifers. A
lot of what we do trying to get him into showing is the fact that it's teaching him discipline, respect for the animals, and it's going to continue to give him lifelong skills throughout his life.
But I think it's very important that, you know, the next generation understands how important the beef industry is. Just like Huck here, we plan on him one day operating this farm. And, you know, if we can do that, we're doing what we need to. Because, you know, this country is founded upon people that, you know, have family traditions and do a really good job of keeping those traditions going. Huck, one day, what kind of cows do you want to grow up to have, you think?
Charolais.
Charolais, all right. You know, if the beef checkoff dollars are going to really good causes and really promoting beef, then the consumers are going to want to buy more beef, and that leads for us making more money in the end, and it really helps the quality of people's cow herds because we're able to enhance our genetics even more.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well on their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we'll be glad to answer it and work with you.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Chris Blevins, who is an associate clinical professor here in the Veterinary Health Center. He heads up our equine ambulatory clinic and sees a ton of cases, teaches a lot of students, and does a lot of good for the equine industry all across our state and beyond. Thankful for him to take the time to come and be here today. And we're talking about worms. And we've talked about what they cause. We've talked about the different worm types. Now let's get into, what are some of the things you and I are going to do to help clients prevent these from getting in their horses?
I think the big misperception of where people have been as far as deworming the horse is just grab packages of dewormers that they can buy anywhere, and that's what's recommended by the veterinarian. And that's not necessarily the case. I think we need to make sure that we get the veterinarian involved with managing our worms in our horse, because we have resistance. We're becoming more and more resistant to a lot of these worms, are becoming resistant to a lot of the dewormers, and it's kind of regional, but it's one of those things that's starting to come across the U.S., and we have to be very careful about this and really how much we deworm and what product we use as far as deworming.
Okay, so set me up on, let's just kind of, obviously we want you to work with your local practitioner, but just kind of set me up on some basic principles that you would employ in your equine herd when it comes to worms.
Yeah, I think the biggest thing is we start with running a fecal, and we do that during certain times of the year here around Kansas, because there's what's called hypobiosis, or the aspects of when the animal or the worms shed eggs. And so we want to get a good representative sample of that. Usually that's going to be kind of the late spring or early fall time is when we like to run fecals on the horse to see how many eggs are being shed in there. And then we can figure out, is this horse a high shedder, a medium shedder, a low shedder, or no shedder, as far as some of these eggs due to internal parasites.
Gotcha. So when you do a fecal, can I go out to the pasture? I mean, is there a sampling technique you like? I mean, or do I just take a freshly voided fecal sample and put it in a Ziploc bag or something and take it into the clinic, or what do I do?
Yeah, I think, again, just talk to your veterinarian about what would be the best thing for that, but usually what I'll do is tell them to grab the freshest sample they can find. And it's usually just a couple fecal balls. We don't need the whole pile. So it's just usually just a couple of the fecal balls in a Ziploc bag. And if you're going to submit it to your clinic the next morning, just put it in the fridge. But we just want it to stay cool and moist until you submit it to the lab.
Okay. So go out, and for me, I just carry Ziploc bags around in the gator or whatever. I see one freshly void, I'll just go pick them up right there while they're steaming.
Yep.
And then I know I got a fresh one. I know that I got the sample. Go ahead and cool them down. Next day's fine.
Yep.
Okay.
Yep.
And then when we get it in there, we got about 30 seconds to break. When we get it into the clinic, they'll then run the fecal float.
Yeah. And so they'll look under the microscope and look for how many eggs, and they'll do an egg count, and they'll do that per concentration, or of that grams. It's eggs per gram is usually what we run it as. And so I think that's something. In addition, usually horses, we do individuals and not like big herds. So if you know which horse is defecating, we write that on the Ziploc, because we want to know each horse individually.
Perfect. When we come back, more about prevention of worms in your horses with Dr. Chris Blevins.
With Hardy Insurance, I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
This Prevention Works Minute, brought to you by Beringer Ingelheim Vet Medica, Inc.
Hey folks, welcome to our Prevention Works Minute. This is an outstanding segment, and I'm really glad that we're getting to do this when we talk about preventative medicine for cattle. Biosecurity is important, and a good key component to that is vaccination. When we vaccinate an animal, one thing you need to understand is that they do not work immediately. Matter of fact, it takes 7 to 14 days before the animal, once it's vaccinated, to actually start having an immune response that produces antibodies that are specific for a disease in which we would vaccinate them for. So if I vaccinate a calf for IBR, it's 7 to 14 days before that animal is protected or has antibody to neutralize IBR virus. Once we get out there to 14 to 21 days, the body has memory cells for IBR. That's why we give them a booster, and we get that booster in our titer response. Vaccines don't work immediately, but they're really good for prevention.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Blevins, and we're talking about deworming. And so we've taken the samples, we've identified which horse they came from, we've sent them in the clinic, and they've run their. Now, will you do it before you worm and after you worm, so you can see if there's resistance? I mean, how do we determine if there's resistance?
Yeah, I think the biggest thing is to also remember, when do you collect the sample. And I usually tell people, make sure it's been at least a month since their last deworming when they're getting their first sample. Okay. So that's usually what we do in that aspect. So then we kind of have a clean slate of where we're at. Don't just deworm and then let's run in a fecal just to see where we're at, because it's more likely it's not going to be a good representative sample initially. And then after that, we make recommendations, whether they are high shedders, medium shedders, or low shedders, based on their eggs per gram. And the veterinarian can work with you in figuring out what dewormer let's try first. And usually after you deworm, then we go 2 weeks after that and let's see if it decreased that count. And so I think that's the biggest thing we want to make sure is we get greater than 90% reduction in the eggs per gram after deworming.
And we're doing those in cattle, the fecal egg reduction tests and different things of that nature. So talk to me about what you guys are kind of recommending right now. What's the core recommendation on deworming times the year and obviously switching of products?
Yeah, I think the biggest thing that we do is, again, based on the fecal, usually a spring-fall deworming is usually what twice a year. And that's even if there's no parasite seen or minimal or low eggs per gram or low shedder on a horse. Why? Is because we don't want large strongyles to come back and cause issues, and that's where it can get into blood vessels and stuff like that we were talking about earlier. So I think we have to be careful not to just stop deworming even when we run eggs per gram.
Okay. And then we hear things about, I mean, in cattle we hear about the resistance, but we only got a couple of products. And so is that the same in equine? I mean, you only have a few products. So when you talk about switching them back and forth and things to that nature, we do that some in beef, but I don't know that how big a difference it makes.
Yeah, and I think that's something that even in horses we're still trying to figure out, like what's going to be the best thing. Because, you know, prior to doing the fecals, it was like rotate dewormers, and then people start just rotate from one dewormer to the next every month, and then, you know, we're potentially going to get more and more resistance, possibly, you know, as we're looking forward in the future of this. So I think that's something we have to keep in mind. We have internal parasites, we have different dewormers, but none that are new coming out. You know, we have the moxidectins, the ivermectins, the praziquantel for the tapeworms, and then we have Panicure or fenbendazole, you know, and other products that are out there. So it's kind of minimal, but we have those to kind of work with.
Great. Well, thanks for being on the show. As always, Dr. Blevins is a great source of information, all things equine and a few other species as well. Folks, thanks for watching DocTalk. Remember, if you want to learn more about us, find us on the web at www.doctalktv.com. Always work with your local veterinarian. For Dr. Chris Blevins, I'm Dr. Dan Thomson here at Kansas State University. Thanks for sending us your hats. Thanks for watching DocTalk, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.